Hi guys, Dr. G here for day 10 of Checkups with Dr. G, and today I am talking or starting the conversation about hypertension. Now, hypertension is something that greatly impacts the African American community or people of color. As a matter of fact, being an African American is considered a risk factor for hypertension. Again, being an African American is considered a risk factor for hypertension. Now, hypertension is a blood pressure that is greater than 129 over 89. Again, it's a blood pressure that's greater than 129 over 89. If your blood pressure is between 120 to 80 to 129, 120 to 129 over 80 to 89, that is considered pre-hypertension. I'll repeat it again. 120 to 129 over 80 to 89 is considered pre-hypertension. If your blood pressure is greater than 160 over 100, then that is considered stage 2 hypertension. So primary or essential hypertension is the most common type, and its risk factors include family history of hypertension, diet, salt intake, smoking. Again, being an African American, living a sedentary lifestyle, as most of us do in America these days, all of these things put us at a risk for having hypertension. Now, secondary hypertension is a type of hypertension that happens as a result of other conditions, such as kidney failure, primary aldosteronism, Cushing's disease, um, hyperthyroidism can be a causative factor, and just other conditions such as that. There's a tumor, a brain tumor called pheochromocytoma that can cause secondary hypertension, but again, that one is less common than primary or essential hypertension. Another risk factor for primary or essential hypertension is going to be stress. We talked about that on yesterday, as well as post-traumatic stress disorder. So that is a risk factor for hypertension as well. So some of the signs and symptoms that you can look out for are blurred vision, having headaches in the back of the head, at the base of the skull. That's called the occiput region. So occipital headaches, blurred vision. There can be heaviness on the left side. Having hot flashes and palpitations can also be signs. But guys, a lot of the times people either don't recognize the signs or they don't pay attention to the signs. Even when they know they have hypertension, they kind of miss those cues. And that is why we have to be careful with hypertension, because it is called the silent killer, because we either don't pay attention to the signs or we miss the cues, we miss the signs. We go on about our day without controlling our hypertension, without changing our risk factors, and it can cause complications such as stroke, congestive heart failure, coronary artery disease, kidney or renal failure, and things like that that can cause death in patients or clients. So you want to make sure that, again, if you are dealing with hypertension, that you are staying on top of it, making sure that you are taking the medications that have been given to you, making sure that you are checking your blood pressure on a regular basis, making sure that you are implementing the changes that you can implement to help to offset your blood pressure and to help bring it down. If you're dealing with secondary hypertension, you want to make sure you are following up with your doctors regularly so that your condition remains under control, so that your hypertension can remain under control. But with primary or essential hypertension, again, you want to make sure that you are doing what you can do to make sure that your blood pressure stays under control, even to the point of checking your blood pressure on a daily basis. Now, you can purchase blood pressure cuffs online. They have the electronic ones. Walgreens and other stores have the ones you can walk up and put your arm in. Making sure that you are keeping your doctor's appointment so that they have a regular log of what your blood pressure is always important. And again, just stay on top of your blood pressure. Now, tomorrow, again, this was just starting the conversation about hypertension. Tomorrow, I'm going to finish the conversation about hypertension on my end by discussing hypertension in African Americans, just some of the things that are believed or hypothesized to be causation for why it's greater in African Americans. And I'm also going to talk about some of the things that you can do to help yourself and, that you can suggest to others to get help with their hypertension. So, guys, this is Dr. G. Again, this was day 10 of Checkups with Dr. G. We're starting the conversation about hypertension. Tomorrow, we will go over how it impacts African Americans and some of the things you can do to help on day 11 of Checkups with Dr. G. If you have any questions, feel free to drop comments below. If you you can email me at wholeyouwithdrg or wholeyouwithg@gmail.com. You can send me a direct message at wholeyouwithg on Twitter, Instagram, or Facebook. And again, guys, I do want to put this disclaimer out here. If you are experiencing blood pressure that is greater than 180 over 100 or 120, please make sure that you are contacting your primary care provider immediately so that you can get the help that you need. Okay? Remember that. So again, I will be back tomorrow to complete my end of the conversation about hypertension on day 11 of Checkups with Dr. G. With Dr. G. I hope you guys have an amazing night, and I will see you tomorrow.